YouTube.
Okay. Okay, so our tonight's presentation will be building quality from within our continuous process improvement journey. Our speaker is Dr. Cherron Blakely. Dr. Blakely is a member of the senior leadership team in the Office of Product Evaluation and Quality, Center for Devices and Radiological Health, the FDA. Where she leads the quality team that supports the super office and continues research about how leaders use QM tools and techniques to achieve business excellence. Cherron has also served as a National Baldrige Examiner and is currently an adjunct faculty at the University of Maryland Global Campus MBA program. She has over 26 years in federal service, which began in the United States Army. Prior to joining the FDA, she served in several positions in hospital operations, quality management, healthcare compliance with the Veterans Administration in Georgia, and the VA Central Office in Washington, D.C. She also worked several years as laboratory manager at a VA medical center. She has a diverse background, training, including certifications as a medical laboratory scientist, project management, mentor fellow, quality improvement associate, quality auditor, Lean Six Sigma, green and black belt. And she has a doctorate in business administration, a master's degree in business administration, and a bachelor's degree in clinical laboratory science. So we all please welcome Dr. Cherron Blakely. You're muted. Let's see if I can unmute you.
There you go.
Good afternoon. Can you hear me okay?
Yes, now I can. And I do hope I
right.
pronounced your name properly.
You absolutely did.
Thanks.
Yeah, you got it just right. Well, thank you for that introduction and for reviewing my bio. Greetings, Phoenix. Thank you for having me. It's my pleasure to share with you some of what I actually shared at a WCQI conference, I want to say 5 years ago. And so today I'll just update you on our progress and tell you a little bit about how we continue process improvement from inside of the FDA. So let me just bring up my slides here.
So can you take control, or do you want me to stop sharing?
Yep.
There we go.
Perfect. You got it.
All right. Thank you. So I'll breeze past the bio since you've already done that. Just to set the stage a bit, not sure how much you're familiar with FDA, but we're actually one of the oldest consumer protection agencies founded by the federal government back in 1906. There have been a number of acts that have been passed since inception, but in the 60s and 70s, there was a lot of requests from the public for more oversight of medical devices. You've likely heard many of the stories of Dialamod and other quack drugs that made to the market. And so initially our counterparts in the Center for Drugs started off with a lot of initial congressional and statutory oversight, and later built in medical device oversight, as well as biologics, foods, cosmetics, etc. So in 1982 was when FDA at that point in time pulled together a number of different smaller offices that were responsible for a lot of the regulatory oversight surrounding different types of medical devices to form what we now call the Center for Devices and Radiological Health. So I'm a member of CDRH. So CDRH, we have a quality policy that you see here, in addition to our mission statement, where we protect and promote public health by making sure that there are medical devices on the market that are both safe and effective. And we're committed to continually improving our quality management system. So just as you understand a little bit about our org structure, within our center, we have a quality management council that sits at the center's immediate office, and they're responsible for maintaining our quality management system where we house our SOPs, policies, et cetera. Also, any of the requirements for how we do process improvement, how our audits are facilitated, as well as performance measures and our corporate data warehouse. I have a small team that sits inside of the Office of Product Evaluation and Quality, and I'll talk a little bit more about what we do there. So much of what I'll share with you this evening is really about what we do within that small group inside of what we call OPEC. So our center's program, it's called the Quality Management Office of Organizational Excellence. They adopted an ISO 9001 framework many years ago and have been ISO 9001 certified for the past 3 years. We have a pretty robust program. On this slide, you can see many of the different functions that they do provide to service our center of almost 2,100 employees inside of the federal government. We had a reorg, and this is when I presented at WCQI inside of the center, where we took 4 different offices and merged them into one big office that we termed the super office. And we established a few more additional offices. So today I'm going to speak specifically about what we do inside of the Office of Product Evaluation and Quality, which is the office that was created once we restructured. But please know that across these other offices, they also have quality management staff. So in terms of at the time of our restructure, we merged a number of programs, post-market surveillance, compliance and enforcement, and pre-market review, all into this big office that is now called OPEC. And it was really to align staff across these different programs so that they are functioning collectively across those spaces in TPLC. We also wanted to increase staff growth and development, ensure that information sharing was at its maximum, as well as improve upon the work-life balance for our employees, and ensure that there was collective decision-making. So if we have a pre-market team who is evaluating a medical device application, and if there are other devices in that same class of device, whatever was happening, whether it was once the device application was approved or years after it had been on the market, the team collectively are working together to ensure that there's continuity in whatever's happening in that space, whether it's a inspection of one of their manufacturing sites and something's discovered. They want the pre-market team that approved that device to know, whether it is a medical device report that came in that is signaling a number of deaths related to a medical device. They want, holistically, they want the entire team that might be involved with that device to know. So these are some of the drivers at the time that we wanted to make this change, and part of why we had this challenge in front of us to transform the way we used to function to the way we now function today. So as I've said, we reorganized the staff, reshuffled the deck, if you will, and aligned all the pre-market staff, the post-market surveillance staff, and the compliance staff into one specific area. We call them offices of health technology. And if you think of the human body from the top of the head down to the feet, each of those OHTs have been reorganized as you move down the body to specialize in those specific areas. For example, OHT1 is our ophthalmology OHT. And so all the devices that are somehow affected from the head and especially the eyes, all are serviced and reviewed by that particular office. And as you move down the body, they each work across. And so we really now have what we call end-to-end regulatory oversight of medical devices in device-specific areas where all of the professionals work together. The medical officers, the consumer safety officers, the engineers, the epidemiologists, and other interdisciplinary scientists are all working collectively. So OPEC continues to ensure that patients have access to high quality, safe and effective devices across the TPLC through our day-to-day business. As I've said, we review applications for medical devices, and we continuously regulate those medical devices that have been approved to be on the market in the U.S. This comprises over 1,500 employees, again, from medical doctors to engineers, nurses, other allied health professionals, and administrative staff. And we reorganized so that all of the pre-market, post-market compliance activities are all working together under each of these offices. So my team, embedded within OPEC, is primarily their first line of QM support for all things document control, management review, performance measurement and monitoring, process improvement, quality management training, and communication. And we work alongside both the leaders and employees, as well as stakeholders, on informal and formal business practices and processes. We administer the internal quality management system for OPEC. We have a number of controlled documents, and so depending on where those documents reside inside of our office, we really support the infrastructure to maintain all of those SOPs, work instructions, forms, and templates. So we're a mighty team of 4. We used to be a team of 5, and one of our team members retired. And this is a picture of us at WCQI 2024 out in San Diego, California. And so we try to get out to WCQI and network with all of the quality professionals as much as we can. We've structured the way we do our work across the 5 main pillars that you see here. So we spend a lot of time in document control. We facilitate process improvement, performance monitoring and tracking, as well as conducting internal audits and assessments, and engage with leadership, whether it be through our quarterly management review or interact with leadership about other related quality activities, or when incidences occur and they want us to perform root cause analysis sessions and facilitate those meetings. So I'm going to unpack a little bit about these pillars, but I'll talk very specifically about process improvement so that you get a sense of how we function. So for document control, when we reorganized, we took 4 offices with different functions and merged them into the super office that we call OPEC. And as you can imagine, that was not an easy feat. Each office had functioned on their own. They had their own quality staff. They had different policies and procedures and practices. So merging 4 offices into one of the first orders of business, as I engaged with the executive who was the office director, was how we get ourselves organized under this new banner called OPEC. Some of the first key questions we asked ourselves included what were our core procedures. So what's the core body of work? What's the bread and butter of OPEC? So across TPLC, we had to identify those things. Additionally, what are the supportive processes as well as the admin processes? Are they documented, and are they current? And have we identified goals or performance standards for the work that's being accomplished? And are we meeting those goals? And are we consistently following those procedures that have been documented? And so across all of these areas, from these 4 offices that merged into one, the status of where we were was on the spectrum of nothing documented to very specifically or granularly document it down to probably a level of detail that wasn't easy to teach new people. So we had to initiate a project where we would simplify and lean out the core procedures that had been identified for OPEC. And so this is kind of the list here. The first few are some of the pre-market. In the middle are some of the compliance processes. And then as you work down the list, some of the post-market surveillance functions. So for all the 20 procedures, we had to do an account of what are the control documents that we possess for all this core work. Were they SOPs? Were they work instructions? Were they forms? Were they templates? Were they accurate? And really take stock across all 20. So this was a pretty robust project team. We had a smaller team for every 4 procedure that you see here. Working with this team, we had to first start with, no matter where each of these teams were with documented procedures, we all went along the same process of identifying for the new office, tell us in 4 the big steps what, how the work is accomplished for those specific areas. So if it was allegations of regulatory misconduct, in 4 to 6 big steps, how does your team process allegations of regulatory misconduct? And we did that for all 20 teams. Once all 20 teams identified their high-level process map, we conducted a marathon where those 1,500 employees had an opportunity to engage with all of the team members for the 20 core procedures and ask clarifying questions, comments, suggestions, provide ideas in an effort to socialize these procedures with the workforce. And to get as much feedback about what wasn't clear, what was missing. You know, we used to do this, what do we do now? To really just engage with the entire workforce. And so the picture that you see at the upper left is actually a snapshot of where this core procedure marathon was conducted. We called it a gallery walk, and we kept it up for 3 days to allow individuals to come in across those 3 days. And we had representatives pulling shifts from the 20 different process areas to facilitate questions. And then we had sticky notes and markers. So let's say if it was an unmanned time frame and an employee came in, they were able to still walk along the gallery of core procedures and leave notes, comments, questions, and we can, reconcile those comments and questions that were left in an effort to, again, socialize as much as we could with the workforce. Then those teams incorporated the feedback that they received to determine what, if anything, they were going to do with the feedback. And after we completed the socialization effort, we also had each of the teams walk through with the office directors that were going to be leading these OHTs that I mentioned previously to ensure that the executives understood how the work would be accomplished and what would be expected of the review staff that worked inside of their respective offices. As you can imagine, this was a pretty significant body of work, and the team received recognition for this project. We actually accomplished all this work in 4 months. And so by the time Congress approved the restructuring of this new office, we were then able to get right out the gate with SOPs and training for employees. And for employees that had never performed the work before, we had documented procedures for them to learn the new work that they would be performing in the new structured organization. So just to give you a layer deeper of granularity in the project, we had several phases of this project. First, we did that inventory that I mentioned. What are all those procedures that exist across the 4 offices, but what we had identified as the core procedures. Initially, I was a part of the Office of Compliance, and we came to the table with what we called affectionately our top 10 procedures. And so we had a body of work where we were moving along with this project, but when other executives found out about what we were doing, they said, we want in on this action too. We'd like to tag on and include these additional core procedures, which is how we ended up with a total of 20 teams in order to do this work. So once we identified all of these top core procedures, socialized the procedures that were developed in the new state, and then engaged with executives, each team had their own executive sponsor to assist them with working through barriers, challenges, resources, and then we developed a sign-off process so that we could launch into the training materials that were going to be developed for the procedures. Once we identified and developed the training, we then had to identify which of the staff would be responsible for completing the different training across the product life cycle. We then conducted that training and we assessed the training. So we used the various Kirkpatrick levels, at least levels 1 through 3, because we wanted to provide an overview of everything for all of the workforce. But then depending on what type of reviewer you were, you would have gone on to the second level of training or the intermediate training. And we wanted to be able to assess just a general understanding all the way through to the individual is able to act independently and perform that core body of work without assistance. So we were pretty detailed in the training, but also thinking about the end in mind of how we would assess the adequacy as time went on. Luckily, while we were waiting for Congress to approve our restructuring, we were allowed time to pilot the new procedures. So aside from us socializing, vetting through executives, we wanted to play with these new procedures and monitor if there were questions or feedback once people were able to actually get a work assignment using those new procedures to say, oh, there's still something not right here, or I think there's a step here that I'm not quite sure I understood. So for the pilot, we had to create a feedback loop so that if there was an employee working through this, a procedure, and they had a question or a comment, they had a mechanism to send back to the executive sponsor and the author of that procedure any and all questions that came up related to that. So this was a really good process and approach that we took for 20 core procedures, again, impacting over 1,500 employees. And within that phase 3, we took a PDSA approach. Each time we received any feedback about the procedures during the pilot, made sure we had good paperwork to capture this. We actually used SharePoint and logged in any and all entries with unique identifiers so we could keep track and ensure that we reconciled the types of feedback that was received. We piloted these procedures for about 6 months, and around the time we finally heard from Congress that our reorganization was approved, we were ready then to finalize and publish these control documents and move right into control and sustainability. And in sustainability, we kept the feedback loops that we created available so that if there was a broken hyperlink, someone had a question, the process changed, but we missed a step. We wanted to keep that feedback loop available so people could continue to send feedback, and it's still active today where people can send in feedback if they've got questions or comments, suggestions, ideas about a core procedure. And then we monitor the respective targets and performance in all of the 20 core procedure areas. So we have our work currently situated still in the big buckets of pre-market, compliance, and post-market. But I did mention to you previously that our center obtained ISO 9001 certification for our quality management system, and decided that this would be a stretch goal for the entire offices across our center to also seek ISO 9001 certification. So for our office, we are currently in the process of preparing for ISO 9001 certification. We're going to do a gap analysis first, and depending on what we find through that gap analysis by the ISO 9001 consultant, we'll know what shape we're in to then move into the ISO 9001 certification audit. So we still have things arranged across the product life cycle surrounding these three products in key focus areas, but we recognize that we might have to continue to streamline our work and making sure that all of our employees understand at a high level how we function as an office. And we also have contractors that we now have to spend some time making sure they are fully trained and understand how we function as an office. So this is our current state. It'll be interesting to see how much we continuously improve upon these process areas, or if we make any specific changes, transformative changes beyond our current state for purposes of ISO 9001. So our continuous process improvement efforts really center around the 20 core procedures that I've shared with you. And to give you a little bit of understanding of how we function with CPI, inside of OPEC, my QAS team, we function as improvement advisors for those 20 core procedures. We're all either Six Sigma certified belt, and we have a yellow belt. And in addition to Six Sigma training, I also have training in design thinking. Not sure how much you know about design thinking. It's not really considered an improvement methodology, although I see some similarities in the methodology for design thinking. But those that instruct design thinking will tell you that it's useful for solving what they consider wicked problems. There's a step at the very beginning that's called empathy, where you spend time just understanding from so many different perspectives what a problem is in a particular program, process, or area. And so they use things like journey maps to understand and further empathize with each of the stakeholders in a specific area to understand what the source of the problems are. In addition to our improvement capability in-house, the improvement advisors that we also have a contract with a company, and they provide Six Sigma facilitation for big or complex projects. And they also use Scrum because we have a lot of projects that are surrounding the need to improve upon the systems that we use or develop the requirements for a system that we want to acquire in the future or potentially go through acquisitions and contracting. So in-house, we have both the contractors that we use for more complex work, but then my team, we facilitate process improvement inside of OPEC. So for a lot of our Six Sigma projects, they're either DMAIC, most of them are, because as I've shared with you, for those 20 core procedures, it's very well documented, but we might need to tweak it, improve upon the variability across the 8 offices that perform the work. And then anytime there's a need for a new process area development, we use DMAIC for that. For PDSA, we typically will do that with either existing work, or if a program contacts us and says, hey, I want to improve upon this little part of the process, we'll just deploy, PDCA in order to do that and just facilitate that work. But we try to coach the program that might be doing that in order to give them ownership and really be empowered to spawn improvement as they need to equip them with the tools that they need to continue to do that without our assistance. On occasion, we'll have Kaizen events, and we'll either do a full Kaizen 3 to 5 day workshop, or we'll do a modular Kaizen and do steps of DMAIC to set aside 2 or 3 days to knock out a portion because an issue has popped up. And then the design thinking, There's one project in particular that comes to mind where we had to deploy some of design thinking just because we thought we had fixed the problem and it kept popping up again and again and again. So we utilized the empathize portion and prototype portion of design thinking as a way to try to really pull back the hood to figure out why do we keep revisiting this specific area as a problem. So for the start of OPEC, when we restructured and reorganized, in addition to that core procedures effort that I mentioned where each of the teams developed 4 to big steps, socialized their procedure, as well as developed the SOP and training materials for training the workforce, they were all promised an opportunity, should they want to work with the contracted company to do additional process improvement should they feel the need to. And so as we obtain that contract, each of the 24 procedures and a few other procedures from other parts of our center had their placeholder or their space in order for them to kick off. I mention this because initially the plan was you all do your core procedures, but then all of your teams are still going to go through the BPI project with the contractor. And as you can see here, you probably look at the schedule and say, wow, this is pretty robust. And it was. Our teams became exhausted very quickly. Teams fell behind. And what was realized is while the contractor wanted to take kind of the cookie cutter approach and say, we're going to do these rapid process improvement projects in 6 to 8 weeks, it was difficult. It was challenging to stick onto that schedule. And so some teams ended up having to be suspended. Some fell behind. Others, which were green lighted to begin later on, ended up getting pushed to later dates. And so we very quickly saw that while due good intention to send each of the teams through the BPI with the contractor, it just wasn't realistic and it wasn't going to be plausible in the time frame that was set aside in order to do so. So we had to make some adjustments in the schedule. We then had to deviate from that original schedule and revise it, but we also had to off-ramp some of the areas because we determined that we didn't necessarily need a full-blown BPI project to take through all phases of DMAIC, but maybe they needed some help with a Venn diagram or a RACI chart or a value stream map. And then for others, because of personnel changes, we had to suspend them until a later date, until such time we either hired or successfully brought on the additional people that was identified that they were going to need. So, you know, it's something to say about if you're considering a contractor outfit to assist you with your process improvement inside of organizations, really take stock of not tapping those same players over and over again so that they are a part of, you know, 3 teams that are going through BPI concurrently when they have a day job that they have to step away from in order to do this kind of work. And that was an important lesson that we learned, and the leaders that really felt that the overly ambitious project schedule to spawn all this process improvement at the same time really wasn't realistic. So for our internal improvement capability, the QM staff continued to work with all of the programs if they raise their hand or reach out to say they need assistance. We additionally provide ASQ specialized training. So we'll either bring an ASQ instructor prior to COVID, and since COVID, we've attempted to have ASQ faculty conduct virtual courses. Those are more challenging is what we've discovered, but having employees, not quality practitioners, but employees go through yellow belt training and green belt training has really helped with improvement capability, because for the employees, the managers, their team leads that feel comfortable and empowered to use tools, quality tools, they've been able to do so. We've allowed them to sit for the certification exams for a lot of the QM specialty training. And our leadership also went through an executive level yellow belt course so that they themselves also, as they're doing their strategic planning throughout the year, they may initiate and identify PI projects that they want to see accomplished throughout the year. The contracted resource that I mentioned, we still use them, but we now use them for more program redesign. So very complex projects where it's not this 6 to 8 week rapid process improvement effort. It is taking a critical look at a program and how we inherently make it better. So I'm not sure how much longer we'll continue to have that contracted resource, but it's been helpful to continue to leverage them for some of the more complex courses, especially since they have additional resources. You know, they have a whole boatload of black belts, master black belts, and green belts to help and continue to work with teams while we focus on some of those smaller scale process improvements that we can accomplish in 8 to 12 weeks and continue to work on those things. They also will provide consults with us if we need to go to them and say, hey, we're looking for some ideas. Here's what we have come across. Here's what the data is telling us. Do you have any ideas? So it's been good to have that contracted resource to bounce questions off of when we need to. So we continue to facilitate the PI projects. We also coach programs and teams whenever they need to. If they need assistance with using certain tools or they want us to facilitate a focus group, they tap into us whenever necessary. Annually, we do a data call to determine if there are new PI projects on a regular basis, and we've been doing that for the last 5 years. Some years are low and there's not really big projects that are being requested, and in other years we have our hands full with a number of PI projects. We talk to our leadership on a regular basis through our quality management reviews for any formal PI projects that have been chartered so that they can stay engaged and aware of what's happening. And occasionally we'll conduct voice of the customer or surveys upon request, and we work with a social scientist if there's specific surveys that we want assistance with developing. And we continue to look at data on a regular basis to identify opportunities for improvement and any risks independent of the audits that take place. So I'll mention briefly a few of the other things that are a part of our pillars. Our performance measures, monitors, and metrics. We have a quarterly management review that we've been doing since the inception of our office, 2019, and we have them every quarter. We started initially just looking at the QMS performance metrics like customer satisfaction. If we had SOPs that didn't complete their biannual review on time, if there were issues with audit and what that audit schedule included. And as programs saw quality report on performance measures, we then gradually added in the programmatic or the business process measures so that they could start to report on a quarterly basis. And it allowed them to figure out what their data dashboards would look like for us to then migrate some of them to a corporate data warehouse. And we use Power BI, Tableau, and there's one other new one that we're thinking about bringing in. But it's just moving it now that we have it curated to tell us what we need to. Here's a snapshot of some of those early dashboards that we created in Excel or Tableau. And over time, we've been able to mature them and curate them beyond what we started with. But what we found is, you've heard the adage, what gets measured is what matters, and that's continued to hold true even today. When leadership and managers know that the executives are going to be looking at performance, they show up and they make sure that they're doing what they're supposed to. Some of our programs, when they see that there's an area not performing, they will preempt and come prepared to talk about the action planning and what they found about where the opportunity might be there. In terms of audits and internal assessments, we do maintain an annual audit schedule stepping through the various core business processes. And we also have some third-party audits. Most of them are because of our statutory requirements. We have a user fee program we call MEDUFA. And as a result of that, there's an external audit that is requested for the pre-market program that we contract an outside party to come in and audit those. But when we find things with audits, regardless of who's conducting them, they're fed through our management review. And whenever there are non-conformances, we track them until completion. And either we do effectiveness checks or we make sure that the next schedule, wherever there were some issues that they eventually resolve, we are sure to check and make sure that those issues haven't popped up again. So trying to tie all the functions together. At this point, we're kind of rocking and rolling in terms of what we expect to see across. So with the leadership engagement, I won't mention the quarterly management reviews anymore, but I will say, because we took them on this journey to get them to a very comfortable practice, now they use the real-time dashboards and they look at them on a monthly basis, sometimes a daily basis, and they pull their teams and talk to their teams independently about what they're seeing in those performance dashboards. So they're initiating those discussions without quality, and I think that's grand. We've arrived where we hoped that we would, where these leaders are functioning independently and they recognize that it's theirs and theirs to also facilitate. So our quarterly management review, we continue to talk about document control, our customer feedback to include satisfaction ratings, any existing process improvements, the results of audits or action item updates for non-conformances, and then the action item log anytime there's something on there until it's completely resolved. And then the programs report through the process performance section of our quarterly management review. And this has been a well-oiled machine for the last 5 years, that we're now actually taking a portion of our QMR up to the center for them to build out their quarterly management review at that level. And so you saw some of the graphs and bar charts that we started with. As time has gone on, we've become a little bit more streamlined in those approaches, and we have corporate data warehouses where most of this data is housed. And we're able to either move on to a new iteration, go a layer deeper, identify factors surrounding our customer service survey so we really understand what's meaningful, what matters to our customers. So just some closing thoughts. What I've learned on this journey with this big office is that we had to start small. In some areas, we started with quality metrics. In other areas, we just started having just big topical discussion about quality and what quality means to them. What do their customers think of the service that they provide? Do they know if they're meeting their timelines? Engaging leadership early was key for us. So I was fortunate to have that executive who had a vision, who thought, you know, I know you've been working on these core procedures over in that area and you have the top 10. Can we expand that to the top 20? And can we bring the rest of the programs on board? So having them engaged early was very instrumental for us to be able to function well. Having a quality team that's diverse, I think it's also important. Differing perspectives, we have different personalities, different backgrounds, different training. I have one individual who came from pharma. I have another who came from performing inspections inside of FDA, and I have another who came from industry, focused in another area. And also fostering change agents. So these programmatic people who now report in the QMR, bringing them up to speed on quality and what they understood about quality, making sure they either were CQA certified quality auditors, or that they went through the yellow belt course or the green belt course. They've also been helpful in understanding and sharing with other colleagues about our quality journey. And so building in quality gradually was really our key to success. Even when we had external quality training, we also initiated internal engagement about quality, because it's one thing to learn about the body of knowledge, it's a whole nother thing to be able to implement what you've learned. You're going to fail, and you should fail, and you should fail again and again, but you should keep trying. And that's been the appetite that we've been able to build in our office, as well as even with our leadership, is the way they engage when there's an incident that occurs and how they show up to that team, so that it's not punitive, but it's about what are the resources that you need, what are the barriers preventing you from being successful. And when there are successes, we celebrate them publicly, we recognize them, and we do that on a regular basis. It's also been helpful to learn different methodologies. So as I said, Lean, Six Sigma, being able to pull in design thinking and learn about that body of work. Having all those different tools in the toolbox, I think, is important. It's also for the diversity of your team. Quality being free, you've heard that, but being able to really make sure that it's accessible and available for anyone that's interested, I think, is important. I remind my team to have fun, because there are going to be days where it's just frustrating. It's this team that we just can't seem to get over the hump. And being able to continue to engage where we can and keep people engaged. How we show up and how we interact with them has been, very important. And then lastly, we always review our work this way. Improving our work is our work, and that's how we describe ourselves. I actually picked that up from VA. VA had a very robust quality management program years ago called Systems Redesign, and that was the mantra for Systems Redesign. And it's been great to be able to kind of bring that into FDA and continue to utilize that mantra here. So I'd be remiss if I didn't mention to you that my team, we're currently conducting research about what the desired proficiency and competency is for today's quality professional. So should you all be interested, there's an anonymous survey, and anyone that might be interested in being interviewed to kind of share your perspectives around quality, please reach out. I'm the principal investigator on the project, and we hope to bring that back to WCQI in the very near future. And so I've added some information here if you want to know a little bit more about what we're trying to accomplish with that research. So I'll leave you with a couple of resources that you might find useful if you want to read a little bit more about FDA's history, some of the transformational efforts that I've mentioned, as well as design thinking. So with that, I thank you, and I'll open up to see if you have any questions or comments or reflections for me.
Anybody have any questions? So Cherron, I have a question. What are some of the key metrics that you're using to measure the effectiveness of these changes? I'm especially curious about any performance metrics you might have representing the customer, the voice of the customer. What's the feedback been since these changes have been made? Have they noticed I don't know, was the purpose a reduction of lead time, cycle time, quality of effectiveness? I didn't see any mention or hear any mention of customer related metrics.
So yes, thank you for the question. We do. I didn't include a lot of that in here because of our Medusa relationships with industry. It's always difficult because you've got to weed through any proprietary or other information that's in there to get that set, and then you got to vet it through a number of people before you can present it, but I'll discuss it. So through our user fee agreements, we're responsible for meeting certain deadlines in terms of how long we complete our reviews of medical device applications that come in across the pre-market space. We talk about those performance measures, not just if we're meeting our deadlines, which we would do quite well, but we also conduct surveys with industry to talk a little bit about whether or not we're meeting their needs in terms of, are our people responding timely? Are we giving them the information that they need? And then I mentioned we have this feedback loop, independent of the surveys that we do, independent of their ability to look at our performance and the commitment letter that we do every 5 years with the medical device industry. They have the ability to send us through the either appeal process or through the customer service mechanism anytime they're dissatisfied or unhappy with something that they are or are not receiving from our employees. And so we let the data speak for itself in the sense that we either get follow-up from them to say, wow, you know, it used to be this way and now we're very happy that we get this, or they'll do a follow-up message to say, you know, this person didn't give me what I needed, or they sent us, you know, an additional information letter, but didn't give us the details that we needed. Thank you for following up. We're so happy with the changes that you're making. So we use a lot of the follow-up that we get through those mechanisms that I've listed or mentioned as a way to know that we're on the right track. And with the user fee negotiations, they come back to us if there are challenges or concerns that they have before they agree, the medical device industry, to up the ante on whatever they're paying for in the pre-market space. So it's through those ways we try to keep track of that. And we have the quarterly management review that I mentioned. We walk through and we look at our times, our completion times of a review for everything that's coming through. And then lastly, the executive has a call monthly with the trade organization executives to say, what's coming up through your trade organization? Are you getting feedback from companies? Are there things we need to talk about? So it's kind of having a couple of both formal and informal touch points as a way for us to know that we're making the progress that we expect. So I hope that's helpful in understanding some of that.
Sure. We do have a question from the audience. Her microphone isn't working, but Emily asks, has OPEC partnered with other federal agencies doing continuous improvement to share learning, such as the EPA has their lean programs or the OPM department's design thinking?
Yeah, so I love that. I will tell you that I haven't. A lot of how I engage with other federal agencies has either been through ASQ conferences where I'll meet my counterparts from those other agencies, or if they reach out. GAO, maybe 3 years ago, was trying to pull together a federal agency quality council, like an informal council to bring us together. But they, you know, we're like 4 sub-agency levels down, OPEC is. And so they ended up having people at the top of the organization work in tandem with GAO and other government agencies, but all of us haven't had that opportunity. But it is something that we are very interested in. It was something that I was accustomed to when I worked in VA, the systems redesign program I mentioned. We had annual conferences where we brought in the quality professionals from everywhere across the US to one conference location, and we would share everything and share ideas, share projects, networking. So ASQ has been the one way I've been able to do that. And I did not know that OPM had a design thinking course. I'll have to check into that, because the design thinking course that we've used is with a local university in Maryland. So thank you for that.
Okay. Anyone else have any questions? Don't see any. So have you institutionalized any type of knowledge management system to share best practices and key learnings, and thinking in terms also of employee turnover? Where do you store all the best practices and key learnings within your organization. As you're going through all this organizational change, there's obviously the threat that a lot of that experience might be lost.
Yeah, no, that's a great question. We try to maximize the use of SharePoint as much as we can in getting knowledge out there, independent of our document control system and independent of our learning management system, especially when things aren't actually 508 compliant to go in the LMS, but it's still good content that we want to save. So different teams use SharePoint, and we actually have a certain template. So whether you're looking at this office's SharePoint or another office's SharePoint, the look and feel of them are similar, but the content is different. And then separate and distinct from that, depending on our strategic initiatives, where we want to identify things that then we say, oh, this is a best practice. We inventory and keep account of those best practices. So if it's a manager who is looking for best practices on how teams work together to collectively decide upon how to divvy out work, or how to bring the team together to walk through the submissions that are in the queue, we keep repositories for best practices for new managers when they come in to tap into, identified by a point of contact that they can go to and reach out and talk to them if they're still around, or if members of that team are still around. So that's how we try to hold on to some of that continuity.
Okay, great. Thank you. One more opportunity. Any questions? Adriano Lombardi asks, how do you monitor improvement sustainment?
Yeah, that's another great question. Because, I mentioned earlier how we had problems in certain process areas that popped up, and we were called, like, didn't we just do a PI project on this 2 years ago? So our repository allows us to take a look back on if a new project charter is proposed, when's the last time, or if a specific process area has ever gone through a formal improvement project. But in addition to that, through the control plan, some projects come up to 1 year or 2 year updates in our QMR, a quarterly management review, where they'll either say, this is our 2 year update of the PI project we conducted 2 years ago. You might recall these are the measures of success that we solidified at the conclusion of that process. And then they show us the trended data to say we're still meeting, we backslid 1 month or what have you. But based on those updates, we continue to track those and have them come back to us through their control plan to know that those are sustained. So whether it's looking at a repository or whether it's looking at when it comes through the QMR, that's how we really track sustainment to see if there are problems popping up or continuing to pop up.
Okay, thank you. All right, don't see any other questions. I want to thank you, Cherron, for an excellent presentation. Oh, one question for you. Are you willing to share your presentation? And if so, could you send it to me so we can post it to our My ASQ community?
Absolutely, it'll be my pleasure.
Okay.
I'll send that to you as soon as we disconnect.
Yeah, and so my email is just rhmitchell@memberleader.asq.org. So pretty.
RH. All right, perfect.
Great. Thank you very much. And you
All
can
right,
either
thank you.
sign off or you can stay and listen to the business part of our meeting. It's totally up to you, but greatly appreciate your time. Thank you very much.
All right, thank you. Take care, everyone.
Thank you.
Okay. Can you see that, Bob?
Yep, I do.
Okay. So I'll go to the next slide, which is what would we like to do for having some breakout sessions and some networking and for topics tonight.
Yeah, usually we try to come up with a topic. We didn't really
And
have an opportunity this
no,
past planning meeting.
we'll plan better next month for
Yeah,
sure.
well, no apologies. We took quite a bit of time during our planning meeting just to make sure everybody was onboarded and knew their, what expectations were of each of the member leaders during our monthly quote unquote board meeting. So I think that was a very, very worthwhile topic to take on. I heard that from Amy Sigler that someone from Benchmark might be on the call tonight and has
Yes,
some job
yes,
opportunities to talk about.
yes. Maybe this would be a good point or a good time for that.
Yeah. Is anyone from Benchmark here tonight? Doesn't sound like it. I know we had asked Amy to also send those job postings to our placement chair. And for anybody who's interested in, and looking to see what career enhancement opportunities might be available, if you go to the Phoenix section, My ASQ community, and then click on the tab that's titled Discussions, that's where we have our jobs board. And our placement chair, Nicole Donraj, does a fantastic job. I mean, she probably puts a dozen new postings, at least a dozen new postings a week. I mean, for a while there, a year ago or so, she was putting that many on per day. So, uh, if if even out of just curiosity, what's out there, maybe you aren't actively looking for something, but if a director or a VP job becomes available, maybe you might want to consider that. So I would highly encourage you to go out and visit the discussions page on our community site. Anybody else have anything that they'd like to just talk about while we have the group here? I mean, we are all about community. Maybe you have a challenge you're facing at work, and perhaps someone here on the call may have had a similar challenge and would be interested in sharing what they did to resolve that challenge, or if there's any other topic that someone would like to talk about. If
Pretty
not, I
quiet.
have one more topic, bulleted point, that came up today. So as you're hopefully all aware, the ASQ Lean Six Sigma conference is just around the corner. It's always in February of the year, and it's always here in Phoenix, in more specifically in Glendale. So if you have already registered or are planning to register for the Lean Six Sigma conference, the planning committee does have a couple open slots for a conference volunteer. So if you have already registered, so you know where you're going to be going, then you can get an additional discount over what you've paid. So you will be reimbursed by ASQ if you're willing to volunteer some of your hours while you're at the conference. Volunteer activities are usually like moderating the rooms, make sure the speakers can find the room, that the multimedia is working, if any handouts are to be distributed. That's the usual role of a volunteer. So if that applies to you, I would have you get in touch with Hillary Werner. She's our past chair. She's now the regional director for the Mountain region. And she's also a member of the Lean Six Sigma Conference Planning Committee. So if you have registered and you would like to serve as a volunteer, please send an email to Hillary. That's H. Werner at B as in boy, O, D as in dog, board of directors, .asq.org. And she will respond with any remaining availability and get your information. So if indeed you are selected, make sure that you get your reimbursement, your discount reimbursement. So those are my two topics. I'll turn it back over to Rob or anybody else on the call who might have something to share.
Yes, and any other shares? I have just one question of curiosity is we generally have several out of section participants. I'd just be curious to know if you're from, Ohio, New York, California, whatever, and you've joined us tonight.
We have someone from San Francisco. Hey, Robert, how are you? Austin, Texas, Houston, Texas, Toronto, Canada, another Austin, Orange County, Austin. Looks like the furthest one so far was Toronto, Ontario.
Yeah.
Hong Kong. There you go. Andy Chan wins again. Glad to have you again. Yeah. So I will be downloading the Zoom report with all the names and contact information of the attendees, delivering that to our voice of customer chair, Jason, and he will be sending out a thank you letter with your RU cert and also a link to the survey. So that will all be happening in the next couple of days. Go ahead, Rob.
Okay, so as Bob was talking about, we have the Lean Six Sigma conference coming up, and this is going back quite a few years for me, but I have worked as a volunteer there. So if anyone definitely, is interested, I thought it was great working as a volunteer. And again, you can get your cost reimbursement, and are we still giving RUs for participation or for volunteering in that?
Oh yeah, ASQ would assign those RUs, but yes, you get additional
Okay.
RUs for volunteering.
All right, because I did when I did it, but that was quite a few years ago. So we change the rules sometimes. At the ASQ level, we've also got the World Conference on Quality and Improvement. It's going to be in Denver this year. That's May 4th and 5th. And then there's also a collaboration on quality in space and defense industries forum. That'll be in March at Cape Canaveral. All of these are directly off of the ASQ website in order to find out more and to register if you're interested. Okay.
Someone had asked, Adriano had asked if there were any conferences planned for later half of the year. I know in November every year is World Quality Month, and usually there's some type of a conference or event, but I have not heard of anything yet. Now, in October of this year, up in Boulder, Colorado, we will be co-hosting the annual Baldridge Fall Conference. So a little bit of different focus. It's not so much on quality tools and methods, but around organizational performance excellence. And it will be held in Colorado this year. So it's quite a bit closer than the past couple of years when it's been in Baltimore and Coral Gables, Florida. And in Boulder in October, there's not a big chance of snow. And even if it should snow in Boulder, it usually melts within a couple of days. So I don't think weather will be a factor. So if you're interested in learning more about Baldridge and performance excellence, that's the conference to go to learn more about Baldridge. You get, and many organizations send a couple of employees to that conference just to learn more and to hear from other organizations who are just beginning their journey. There's a companion conference coming up in April, and I can't remember where that's at, but it's called the Quest Conference. It's not sponsored by ASQ, although ASQ is one of the enterprise partners of Baldrige. And the Quest Conference is like the opposite of the Baldrige Fall Conference. The Quest Conference is where they host the recent national award winners. And this past year, we had a winner from up in Nevada, the city of Henderson, Nevada, just next door to Las Vegas, won as a community the National Quality Award. And I know there was a national award winner from the Chickasaw Nation in Oklahoma. I think there's a couple they won twice, organizations that won as a small business, and now a few years later, as a much larger business, they have won again in their particular sector category. So if you want to hear from national award winners, you would go to the Quest Conference. If you're interested in more about just learning about Baldrige and what is the journey like, that's where you would go to the Fall Conference. But other than that, I'm not currently aware of any other conferences coming up, but they could happen pretty quickly. So we will certainly keep you appraised of anything we hear. So. Go ahead, Rob.
Okay. So just so everybody that's a member of our section, your three officers for 2025, myself, David, and Amrish. And over here, so again, the three of us, we still need some volunteers for a few things. One being an arrangements coordinator, an Instagram influencer, and a scholarship chair student liaison volunteer. So if you're at all interested in that, you could send an email to the email listed at the bottom, the ASQ Phoenix at sections asq.org. And hopefully.
Yeah, so I mean, we've listed the elected officers. Our total SLT, section leadership team, consists of 15 people. There
right
you go.
there.
There you
So
go. I didn't want to leave anybody out.
Yeah, there's our 2025 Phoenix section leadership committee with our, as per ASQ, the defined elected officers that we need to have in place. And then we have appointed officers, which addresses all the other things that we need in order for us to operate efficiently as a section. So as you can see, there's the arrangement chairs open, scholarship student liaison, our Instagram influencer, and then the special projects for the Lean Six Sigma conference is still open. Bob?
Yeah, that doesn't start. That's the 2026 conference.
Right.
So planning on that begins soon after we wrap up this year's conference. So if you want to be on the planning committee, you'll be working with people from headquarters. And we are part of the team because the conference is always held here within our section boundary. So it only makes sense that someone from the section would also be on the planning committee. So with all of these, you have to be a member of the section. If you'd like to become a member of the section, that's easy to do. You just have to call ASQ customer care and tell them you'd either like to add another section or replace the section you were by default assigned to. If you want to add us as a section, I believe the fee is $20 per year. To add a section, $10 per year to add a division is what it used to be. But the more the merrier. I want to keep this community active and growing. So appreciate anyone who wants to contribute their time.
For sure. We do have several section members who do live quite far out of state, including some of our leadership committee. Actually, they're members of the section, but they reside out of state. The Phoenix section is one of the more active sections. And so, as you may have found, for those of you that are out of state, we do this program, you know, every single month we have a speaker, and not all sections provide that opportunity to their section members. Anything you want to add, Bob?
No, again, I just want to thank everybody who does attend and takes advantage of the opportunity, because they are virtual meetings. So we have, at any given program meeting, we have up to 8 different US states represented, and we even have several different countries represented. So great to have people from around the globe checking in with the Phoenix section. Appreciate it.
So segue into the fact that we do monthly presentations. So we're always looking for presenters, and presentations can be on soft skills or technical skills related to quality in any industry. Presentations should be about an hour, depending on the subject. And you can contact myself or Michael Hossage, who's our programs chair. We can be contacted. Our email addresses are on the Phoenix section website, I believe now, from what I saw, Bob.
Yeah.
So some of the things that we were talking about coming up in 2025, there's been lots of discussion about maybe doing a wine tasting. Again, that's still being discussed. Whether or not that happens, we're not sure right now, but it's an idea that people are interested in. We also have, you know, be on the lookout for event invitations via our constant contact. Registration links are available, you know, on our ASQ Phoenix site under the events tab. And again, if you go to the events tab, you'll find those. And this is exactly where it is on the Phoenix section on my ASQ. If you go there, you'll see various events that are coming up, and this is being continuously updated, maintained. The job board is also found under the discussion section. And then we have the previous program recordings, which you can watch and obtain RUs by emailing Bob for an RU certificate. You do have to, since we are in quality, you do have to provide some objective evidence that you've done it to Bob. And then under the library, we have our newsletters, handouts, presentations, and various other like mini papers or so forth. Lots of information, and you know, on our Phoenix section, my ASQ. So please take a look at that and look at all the resources that we have out there. Okay, so being a member, just quick for those that are not members, you know, our baseline ASQ professional membership level. You know, we do have the professional networking within ASQ. You get discounts on training and various programs and events. You can access various online and published content that non-members don't have access to. Again, updates in the professional news and issues, and attendance at our Phoenix section networking events. There's also a senior membership level, and that includes other Other benefits, criteria for that is you have to be an ASQ member in good standing for at least 1 year and have 10 years of professional experience. And then also having conducted quality related work in the last 2 years, taught quality related classes, so forth. So there are some requirements, obviously, to move up to senior. And let's see. And so the senior members receive additional journals or magazines of their choice, and you also can become a member of an additional section. So if you're in a different section and you were a senior member, you could just add on the Phoenix section. Okay, with your RU certificate that Bob will be mailing out will be a meeting evaluation survey. And we ask you if you would please fill that out for us so we can monitor the effectiveness of our program meetings. For 2025, our program schedule right now is looking at trying to do the 12 hybrid in-person virtual meetings, 4 per quarter with a guest speaker, 1 tour, which would be in-person only, and 1 community outreach event. Again, those are our initial objectives. Other things could be added, or more of those can be added at a later date, depending on what the section leadership team decides. Next month, on February 13th, our program will be enhancing people skills, communicating with younger coworkers, and embracing quality beyond the task, presented by Sandra Menzez.
Rob, if I could go back,
Sure.
just make a slight correction in your opening paragraph on this
I'm
slide.
sorry. I tried to correct it, bring it up to date. What did?
Our new VOC chair is Jason Siebert.
Oh, okay, that's right.
So his email, well, he'll be the one sending you the thank you letter via
Right.
email with the survey link and the RU cert. So
Okay.
and he will be the one, if you do watch older recordings, you will want to contact him to get the RU certificate from those programs as well.
Okay. So I've been QC'd.
It's a lot to cover.
Yeah, I thought I had caught everything and updated it for where we were in 2025, but okay, I'll have to make that change after this. Phoenix section, we're on social media. I don't think any of this has changed.
Actually, we're no longer on the X platform.
Okay.
It's just gotten too political, and I thought that doesn't represent ASQ's code of ethics. So
Okay.
we have removed ourselves from X, or it used to be Twitter. But
Yeah.
all the other 4 are still there.
Okay. That's good. All right. And lastly, any final thoughts, comments, questions from anyone in the audience tonight attending?
Before everybody starts dropping off, I do have one more note to pass along. If anybody is interested in taking an ASQ certification prep class, the Hartford, Connecticut section is offering virtual training classes on a pretty large number of certifications. And all of those classes start in early February. So I just got the heads up 2 days ago. So it's fresh off the press, and it's only a month before they start the classes. But if you are interested, you might want to check them out. Now, we do post their information on our Phoenix My ASQ community. So you can either go to the Hartford My ASQ, or you can just come to the Phoenix section, My ASQ, look at the blog post, and there'll be links and all the information about the dates, the costs, the materials that you'll be using. So if you are interested in taking a certification exam, the classes are currently available through Hartford, Connecticut.
Okay, and with that, we thank you for attending. Be safe, particularly those of you that are out of state and maybe more towards the East Coast. I understand you're definitely getting some winter weather, so be safe.
Yeah, and our thoughts and prayers go out to the people in the Sandy or Los Angeles area,
And California with all of
California
the
Palisades,
fires too.
Pacific Palisades, and all that. But
Yes,
what a wow! It's like World War II out there.
yeah.
It's devastating.
The West Coast is on fire and New England is being buried under snow.
Yeah. All right. Well, thank you, everybody. Appreciate your patronage, and we'll look forward to seeing you next month.
Thank you all. Good night.
Night. And now you can stop the recording now, or when you stop the meeting, it'll also stop the recording. And then tomorrow the recording will be available, so then I will download it to your YouTube page and embed the link on our My